Hi, Dr. Cleban. Thank you so much for meeting with me a second time.
It's a pleasure to be here, Cindy.
So the reason, just for our viewers who are listening as well, that we're doing another one is because I really think it's so important that we check in with cancer patients down the road. You know, they have their doctor's visits, of course, but just check in with how they're doing, what their perspective is, the dynamic things of, your emotions, your life, your relationships, all those things may change in some way, over time. So I'd like to kind of take a view at that, and I really appreciate you being willing to come by. Do you mind letting us know what's happened since we interviewed you last time? I imagine you've had more tests and scans and things like that.
Yes, I see the medical oncologist every 3 months for a checkup, and they do blood work to test something called tumor markers to make sure that there's no suggestion that the cancer is coming back.
Mm-hmm.
Once a year, I have my normal breast imaging. I don't really have to have any other, follow-up or tests. And so far, I've been okay and very happy about that.
Was it easier, or did your feeling about scan after scan change over time? Did you have less anxiety about a scan or less worry about it?
Every time I have to have my mammogram, I do worry.
Mm-hmm.
I think it's pretty normal.
Mm-hmm.
Nobody wants to have another biopsy or think that they might have to have another biopsy or worry that the cancer has come back.
Yeah.
So there is trepidation. And for me, it's hard because when I'm in the mammogram room, I can look at the screen. And since I know how to read them, I would be the first one to know if something came back.
Yeah, it's a little harder.
Too.
Hmm. That's a great example of that saying, sometimes we know too much.
Probably,
Yeah, you're
probably
right
so,
there.
yes.
So, I know that you're aware, because you also work in the field, that we use the term cancer survivor or post-treatment patient. I mean, there's so many terms that we give patients. How do you feel? Do you feel like a survivor? You feel like a current patient, post-patient? How would you characterize yourself?
For me, I guess because I'm more clinical and I treat breast cancer every day and I know everybody does really well, I don't really think about myself in those terms.
Hmm.
But I guess I could say that I am a cancer survivor. I survived having breast cancer.
Hmm.
I, I do worry sometimes about it coming back or coming back in another part of my body. So am I really a survivor? Yes, I went through the treatment and the chemotherapy and the radiation and I survived that.
Hmm.
And as far as I can tell or say, I'm cancer free, but you never know. You still have to be vigilant and still have to watch.
Okay, so yeah, so but the word survivor is okay with you, and you just
Yes,
okay,
yes, absolutely.
okay. So I imagine to some degree over time the relationship with your doctors changed a little from when you were acutely needing their help to now being post treatment. Is that true?
That's true. Now, for me, at least, it's just like going for a regular checkup with my family doctor.
Mm-hmm.
So I have the blood work, I have the exam. They look at my imaging reports, um, and as long as everything's okay, it's fine. But
Mm-hmm.
it's a pretty normal visit, and I'm just used to it, I think.
I can't see that. So, in relationships with other people, colleagues, friends, family.
Everything's fine. I was actually fine until I finished my treatment. Well, my treatment was in 2017 and 2018, and while I was going through everything, I was busy, and there were a lot of people around helping me and interacting with me. And then when you finish everything, it's like there's a void. Everything goes away. And it
Mm.
was at that time, about 6 months after my treatment, that it really hit me. Like, wow, you had breast cancer. And then I sort of felt, I guess the words are very strange in my body and my mind.
Mhm.
Right. It was very sad. Um,
Mhm.
and then, as you get more active and you do more, things that are more normal for you, you feel better. I have
Mhm.
regular interactions with family and friends and colleagues. Nobody comes up to me and says, "Oh, you had breast cancer. don't talk about it. They don't ask me how I'm feeling about it anymore. And
Mhm.
that's fine. They just treat me like a normal person.
Mhm. You know, you fingered that thing that a lot of patients refer to where there's so much attention, so much that you need to do that a lot of people get their plan for treatment down. And then, like you're saying, you do all that. And then it kind of drops you when you finish it all about 6 months later. And then where are you? And for some people, that is when the reality of it really sinks in. And then I hear that a lot of family, friends, and just the nature of medicine too, you're now not needing as much attention. Everybody figures, oh, that's over. So you're not even getting that sort of care from other people, even your doctors. And I can understand how the sadness would creep in and then just this odd void where I guess a transition has to occur, right? That's the transitioning.
That's true, but I think that's true with other things. For example, if you have to have surgery, or
Mhm.
if someone passes away in your family, and people are in touch with you and they send you cards, and they call
Mhm.
you, um, then it sort of peters out and it goes
Yeah.
away, and you feel like, well, where am I, and
Yeah.
what should I do now?
Yeah, where'd everybody go and now where am I? Which I guess is just the whole, like you're saying, that just transitioning from one event in our life through whatever it requires to get through it and then transitioning to another event. So cancer patients, for them transitioning through, then you said you began to do your normal life again and feel like, okay, now I'm back to me. And were there any lingering things as far as, let's just think physical first, any lingering physical things for to not get to normal?
I have to say that I still am more fatigued, or more easily fatigued, than I used to be. I have to go to sleep earlier.
Mm-hmm.
If I don't get exercise and eat properly, I really poop out at the end of the day.
Mm-hmm.
That that's sort of been a persistent thing. I think part of that has to do with the fact that after my radiation therapy, my thyroid became underactive,
Mm.
probably from the radiation, and so I have to take
Mm-hmm.
medication now. I have more body aches
Mm-hmm.
beforehand. I try not to think about it. Maybe it's
Mm-hmm.
just that I'm getting older, or
Mm-hmm.
it's in my
Yeah.
mind. I don't really know. But I would say basically the fatigue.
Mm-hmm.
Some of it is emotional at times.
Mm-hmm.
Sometimes I think about it. I worry a lot because I had what's called triple negative breast cancer, which, if it does come back, it usually comes back within the first 5 years of treatment. And I'm only at year number 3 now. So I worry, if something happens to me, what's going to happen with my family?
Mm-hmm.
And
Mm-hmm.
that adds to the emotional stress and physical manifestations.
Absolutely. So it's the transitioning is so unique with cancer. And then with the type of cancer, there's such a uniqueness to it because, as you said, there are certain like prognostics that you're thinking about, but also you do have body aches and different body changes. And even with the thyroid, that's a risk with certain types of radiation, certain locations of radiation. So there's a lot to get used to again, a lot to get accustomed to and adapt to. And we don't really have a lot of good answers in oncology right now. You don't want to just take more extra medications. I'm running a pilot study right now looking at exercise and helping with fatigue. But as you said so well, it's partly emotional as well as physical. There's a lot of an emotional aspect to the fatigue and the
Right.
sadness too. What
And
helped you the most with all of that?
now,
Yeah.
or before?
What's helping you now with that?
Well, I have to say, since you were a big part of helping me when I was going through my breast cancer journey, the importance of better nutrition,
Good.
which I try to follow as best as I can.
Yeah.
Although I do slide a little bit. Um, uh, Exercise is
Mm-hmm.
very helpful. With the COVID now, I've been watching too much Netflix.
Yeah.
Exercise, but now that I started again, it does make me
Mhm,
feel better. And
mhm,
then to try to do things to occupy your mind, like reading a book or a
mhm,
newspaper, uh,
mhm,
trying to spend more time with nature, and
mhm,
then simple things.
mhm,
Try not to get caught up in the day-to-day stresses, such as
mhm,
work and worry about, am I going to be able to get to the supermarket, and
Mm-hmm.
schedules and things like that.
Mm-hmm.
Like,
Well, you hit
just
on
to try,
everything. Go ahead. I'm sorry.
I think just to try to be simple in a way,
Yeah.
just more natural.
Simplify life, balance it and simplify it. But each thing, like you said, it's so much to put together. Balance it, make sure you have exercise, you're eating right. Then how are you spending your time? You have to have some free time. Like you said, not getting caught up in the stressors of everyday life. If we could just find exactly how to do that. Everybody has to do that their own way though, right? Everybody has their own way to accomplish that and overcome that, balance their life. I like how you mentioned simplicity, simplifying things. Hmm. Do you think that there's anything now that you're looking back and you've moved into an area where you've got a good view of
Nice.
what I need to do? Do you think there's
And
anything you'd change? Like you would have wished you knew more before, or done something different with the doctors, anything like that?
no, my doctors were very supportive. I think they gave me the best care that was available. I did
Mm-hmm.
pick the doctors who I wanted to go to.
Mm-hmm.
Um, and I really appreciate everything that they did, and appreciate the fact that they are giving me state of the art and up to date treatment. No,
Mm-hmm.
I wouldn't have done anything differently.
It's good to know that, good to look back and you did everything you knew with the information you had. So,
I have to say, I appreciate what the doctors did with me and for me, as
mm-hmm.
a myself. Many of my patients complain about their other doctors,
Mm-hmm.
and I try to tell them that they're doing the best that they can, and they try to give you the best treatment that's available, and to try to work with them better and realize that they're human beings also.
Mm-hmm. So that's one of the real benefits, I would say, of you being a doctor yourself, going through the experience, and now you can really explain. I'm sure the patients, you have such credibility with the patients now, in the sense that you get it, you've been there. So for you to say your doctors are doing their best, that gives them an insight from both sides. That's really helpful.
Yeah, absolutely. With my own patients, though, I have to say that it's made me actually be tougher on them.
Oh, yeah. In what way?
Having gone through it, I don't want to listen to any of their excuses anymore.
So they get some tough love from you.
Yeah, I make them, sometimes I'll even show up when they're getting their treatments. I can't do it now with COVID, but I do show up when they're getting their treatments to make sure that they're doing it.
Mm-hmm. Oh, that's good though. They need that, right? Sometimes they need just a little push along, some little strong guidance, and especially since you have been there. Do you think this has changed you in any ways, personally, for the better?
Yes, it had. It's made me more grateful, because I was very grateful for what I was able to have done, and
Mm-hmm.
to come through it in a relatively easy way.
Yeah.
Um, it's made me have some more humility, having to have things done to me that I do to other people as far as
Mm-hmm.
operations and
Mm-hmm.
treatments. And there were some bumps along the way. My treatment wasn't that smooth. I had some bad things happen, but I had to be in the hospital once or twice during my chemo, but got through it. Um, and more understanding, and I think gentler and kinder
Mm-hmm.
people.
Mm-hmm. Those are all really, not that you were all of that before, but now more of it. I mean, those are really good insights. And so many cancer patients have something they call benefit finding. And that's looking back later. You could never say to someone on day one, you're going to really find benefit in this. But, years down, or even 6, 8, 10 months later, you can look back and say, this has made me, like you said, a little more sensitive to what the patients are going through, more humble, things like that. Those are all benefits that all patients. So for you sharing it today, in my mind, it's another way to help other patients see what's good for them, how it can work out for them. That you're a good example of it. It's inspirational, but you're down in the trenches with them as well. So it's just giving them the benefit of seeing a year, 2, 3 years down the road, how you can look back at it. I
You
think
know,
that,
I really don't even think about it on a
yeah.
day-to-day basis. And,
Mhm.
there are memories there, but I
Mhm.
don't think about when I went for my chemo or,
Mhm.
when I had surgery,
Mhm.
uh, because you get involved in day-to-day activities and day-to-day problems.
Mhm.
Um, but now I have a better understanding of the reactions of the people I take care of, and I can actually
Mhm.
address it better, I think,
Mhm.
with my own stories, and
Yeah.
it helps them a lot.
And I'm not sure if we ever spoke about Bernie Siegel's book, Love, Medicine, and Miracles, but he's a surgeon. And he had mentioned that he felt some patients were really from the beginning just not interested or willing to get involved in their survivorship. Do you see a differentiation like that with patients too? Some are ready to get engaged, like you did, get engaged in what you can do for yourself, and some just aren't.
Yes, I definitely see that dichotomy. I
Mhm.
have a lot of patients who actually they're great. They become patient advocates and buddies for other patients. They go to
Mhm.
support groups. They also do podcasts and distribute information. And then there are other patients who maybe it's just their nature. They sort of wallow forever in misery, I'd have to say.
Yeah.
Well, me, why did this happen to me? And it doesn't
Mhm.
help, creates more stress and and anxiety, and that doesn't really help.
Mhm.
Yeah, I have seen most of them for the better. They
Mhm.
support the cause and they help other people, and it's wonderful because I think that'll make our world a better place.
So I know that you have some ideas also for treatment for patients that we should be able to provide in the oncology field more for the patient, like for the other things that they need, like their groups and exercise and things like that. So because I know you've contributed and helped me with the exercise program I have for patients. Do you think that that should be in the oncology setting in the doctor's office, or how do you view helping people that way?
Definitely. I think we have what we call multimodality
Mm-hmm.
treatment, nutrition, exercise, acupuncture, yoga, group meetings for discussion,
Mm-hmm.
things like aromatherapy. And actually, in our practice, we have several breast surgeons in our practice. We're going to be hopefully starting that this year. We're working
Mm-hmm.
on incorporating with you
Yeah.
nutrition and hopefully an exercise program in our office building. And that'll be really great. I think it'll really help a lot of people.
Mm-hmm. So now that you're in this stage of everything, having gone through it, and you are looking at your future. You did mention that you understand the potential risks that you still have, and you're planning for your future. Do you live on a day-to-day basis more and get just more into appreciating today? Does that ring true for you as well? Less planning, or how does that work?
I'm trying to do that more and more now.
Mm-hmm.
I actually just heard an older song um, that talks about how we have to enjoy every day because we'll never be able to celebrate this day again.
Mm-hmm.
Way. So
Mm-hmm.
I try to not let my mind get in the way of doing things that may be new
Mm-hmm.
or just appreciating the things that we have every day.
Mm-hmm.
That has helped me in that way.
Mm-hmm.
I try to help friends and patients and strangers who I may meet who need help.
Mhm, mhm,
It makes me feel better.
mhm. And you're working full time, but you also have time for nature, I take it? You get out, and we're in Florida, so it's easier right now, right?
I
But
work full time. It's a little bit like a zoo around my house. We have cats and a dog, and then outside we feed the birds, and
yeah,
we have a duck family we feed, and there are some cats who come and we feed them, and we go on nature walks, and like I said, the kayaking, and hopefully we'll be able to get to the snow this year. I'm
that'd
not
be
sure, but
great.
hopefully.
So that's great. Something about being out in nature is just so refreshing and
Or even just walking,
rejuvenating.
trying
Yeah.
not to be bogged down by the by daily worries. Just
Mm-hmm.
look at the grass and the flowers and listen to the birds. It's hard to do. If you focus, you can do it.
About focus, yeah. Do you have any other recommendations or comments or things that you'd like to share with patients and non-patients? Really, listen to this. Just people who are trying to get insight, and because some people who are listening might be listening for insight to help their loved one, who had cancer. They may not even be a cancer patient, but just to really understand better what people are going through.
Well, I would like everyone to know that, at least for breast cancer, it's usually very treatable.
Mm-hmm.
And if it's advanced, we have a lot of new therapies. Besides chemotherapy, we have something called immunotherapy, which doesn't have a lot of side effects, which has dramatically changed the course of women who have cancer that's spread to other parts of their body.
Mm-hmm.
They get better. So it's
Mm-hmm.
wonderful. So what I try to tell people is examine your breasts
Mm-hmm.
a month if you can. Go for your mammogram. Don't be afraid that something's going to be found, because if it's not found, then it might be worse.
Mm-hmm.
And then don't be afraid of the treatment, because the treatments are very well tolerated. There's not a lot of pain. There's not a lot of discomfort or side effects. And as far as yourself, it's health is most important, I think, because if you're not in good health, you can't really enjoy anything else. Right? But then
Mm-hmm.
you have to do things for your body. Your body is a temple. You have to feed it well. You have to do exercise for it,
Mm-hmm.
and you have to do things to help your brain function.
Mm-hmm.
So there's a lot to do, but if you just try with little steps, then you'll get there.
Yeah. Okay. Well,
Think that
I also wanted I'm sorry, I cut you off the last part.
that's what you told me.
Oh.
I think I was talking to you one day when I was getting my teeth done, and I was like upset, and
Mhm.
you really helped me.
Mhm. Thank you for saying so. Thank you. And I do really believe that. And I know from my own life too. I mean, we're all just trying to do our best in life and get through whatever challenges come our way. Use the skills we have and learn new skills when things that we haven't encountered before. But you have to be forgiving of yourself and do small steps to get there. I think taking on the big chunks, just doesn't work so well. And I just wanted to say that people who are listening, I'm going to give you a way to reach us if you'd like to, because sometimes I get some comments by email or back on Instagram or wherever this ends up. I'll get comments. So I'm inviting people to share their story with us if they'd like to, and there are ways to reach me behind the scenes. So I wanted to say, since I have you here, in working with your patients for so many years, I've always heard so many wonderful things from your patients about you before you had cancer. So the thing is, now it's just enhanced. Now it's richer because I really believe they feel like they're in someone's hands who feels that she understands them even more, so they feel so secure. It's an extra security, and more doctors who could share their human side with the patients, the better it would be. If they're trained to show that they also have vulnerabilities and they're just doing their best.
Thank you. Thank you for sharing that with me. Um, it makes me feel good. And I also want to say that I'm always available. I don't mind people calling me on my cell phone as long as it's not in the middle of the night. Uh, People call me, and I talk to people all over the country and outside of the United States to give them advice, or just lend an ear and listen to people.
That's great to know. So when I'm going to give my email, and then anyone who does want to speak to Dr. Kleban as well, then I'll funnel you that way. So use me as the back channel, and then we'll control the calls that come in. But it's so great to know. It's amazing to me also how often we have people from out of the country calling, because there are people who get diagnosed are truly on a search for more and more information, different doctors' perspectives. And I think that's so wonderful that you make yourself available for that. And we're trying to make ourselves, Dr. Kleban and I, available in a way that the whole story, for the whole experience, if you're feeling stuck or just need to have another idea of what to do, a little bit of guidance here and there. So we hope that everything we shared today has been helpful. Can you think of anything that I hadn't thought of asking that you wanted to share, or we're pretty good there?
No, I think we're good. And just so people know, you don't have to go through your journey without any help. We're here. We may not know you, but we can become your friend or your support group. And just reach out, and we're there.
Okay, great. Absolutely. Thank you so much for being here today. And for those of you who are listening, whether you are on Spotify or any of the other podcast forums, you'll see written information with my email, but let me state it now just in case you're not seeing that. And that's creation balance. Just run the two words together, creation balance at yahoo.com. So from anywhere in the world, you can reach us that way. So have a great day, Dr. Kleban.
You too. And thank you so much. It was
Thanks.
great being here.
Great. Thank you. Bye-bye.